The next 24 hours proved to be critical. He has lost significant amount of blood. He's cold and unable to form blood clot. Intensive resuscitation and warming is carried out by the surgery trauma ICU nurses, Preston Durant and Kwame Boateng. His intestines continue to swell. His pressure in his abdomen rises to critical level. Chris is unable to deliver blood to his vital organs. He needed another emergency operation. There's no time to take Chris back to the operating room. Dr. Merrill performs the operation at the bedside to release the abdominal pressure and stabilize Chris's condition. The surgery trauma ICU team of nurses, physicians, respiratory therapists, and pharmacists under the leadership of critical care intensivist, Dr. Julie McLaughlin, work around the clock to correct his bleeding, resuscitate, and stabilize him. With his abdomen still open, many more surgeries will be necessary. Chris is at great risk to developing infection and organ failures.
First 24 hours, anything can really happen. You know, you can have some kind of internal bleeding somewhere, and everything is just happening so quick.
The nurse has been working on him for the past 12 hours or so. The process of what's going to take someone like him this critical and put him back together.
So I came in the morning, I received a report on an 18-year-old patient, young gentleman that came in, was really very sick initially when I first saw him. When I went in the room and saw him, had received a lot of blood products through the middle of the night. And basically, honestly speaking, it's one of those patients that you just walk in the room and you really start doubting yourself, is this guy really gonna make it?
Chris had extensive wounds, so we had to do a lot of cleaning out of those wounds. He had multiple surgeries that he had to go through. He had some pretty bad bones that were broken, kind of really bad, an injury in that hip. And initially, we had to kind of support him through all that. We had to support his airway, we had to support the fact that that bullet went in and the infection factors, so he was on a lot of antibiotics right from the get-go. You know, because when you get an injury like that, it's just not about the injury, it's about how it affects the entire body. And with Chris, we were really worried about infection because it's a foreign object, it goes in there and it really did some damage.
Hey Chris, Mom and Dad are here.
They had to give him all this fluid because he'd lost body fluids. And so he was just swollen like the Michelin Man. So, I mean, just to see him, it's like his skin was going to pop. It was so tight. And it was almost like you didn't recognize him.
He was hooked up to so much. You know, they had, I don't know what all the machines are, but all I saw was different machines and tubes, and we were preparing ourselves for the worst.
Chris was very lucky. He had an incredibly loving family, very concerned, very knowledgeable, knew exactly what questions to ask.
Dr. Abutanos would come, and he would always say to us, first, he's doing okay. You know, he would always reassure us. But my heart was in my mouth because I was like, how can this little guy survive this many surgeries? Because, you know, they had to put his intestines back in. They had to live outside of his body for a while. And because of the swelling, they would have to just, little by little, every other day, try to get them back inside his body so that they could close him.
You know, we see this on a regular basis. We are used to this. We are used to seeing trauma patients. But there are some cases that it's a little bit extraordinary. And it's especially when they are that young and they are that innocent and they have so much, you know, potential in their life.
At this stage, Chris Baker has undergone 8 surgeries. August 23rd was particularly worrisome. His heart rate rises to the 150s. His fever climbs to 103 degrees Fahrenheit. In the next 3 days, his white blood cell count, which is an indicator for infection, will climb to a critical level of 43. Chris developed severe infection in his intestines and in his blood. Fluid cultures from the operating room show that the infection has spread to his hip where the bullet has lodged. Chris is septic. He's again fighting for his life. Walter and Grace brace for another roller coaster week. The daily vigils and intense praying continue. August 24th, Dr. Mark Willis from orthopedic surgery removes the bullet from his hip. Dr. Gordon Archer begins a long-term process of finding the right advanced antibiotics to fight off deadly infection. Dietitian Denal Italia devises a plan to ensure Chris has the nutrition he needs to stay strong. The ICU team continues the minute-by-minute critical care management until Chris slowly starts turning the corner. It's a gradual, painstaking process. Chris' relative youth and his strong family support give him a better-than-fighting chance. In the meantime, Chris is at long last taken off the breathing machine and can finally speak. For his parents, who have been holding vigil at his bedside, this brings indescribable joy.
The greatest joy is actually really when he was extubated of the breathing machine and able to say his first few words.
Pain, I know, was one of the frustrating things that he had to deal with. I remember while I was taking care of him, I tried to make sure that if what I gave him, if it didn't work, that we tried something else. And if that didn't work, then I needed to go talk to the doctor and find something to help him, because not only does he have multiple things wrong with him, but he's also got all this pain, and that just makes a person feel really bad when they have so much pain.
A lot of his issues, because of like the infection in his hip, we had to deal a lot with antibiotic therapy, getting a lot of treatment for the infections, also causing that to have issues with his mobility. So having physical therapy and occupational therapy, they were big parts of his care, just to get him to a place where he was physically able to be up and about.
As we saw him get better and he wanted to communicate with his friends, and we occasionally would let people come to see him because we didn't want to compromise anything. We'd come so far. He did have like 2 people that could come all the time, his best friend and his girlfriend. I think that kind of gave him the will that he wanted to come home.